we'll call to order. And is there anybody that you want to introduce?
No, it's 7:33 and no guests today.
Okay. Approval of today's agenda items. Are there any corrections, changes to the agenda?
I have one addition to the agenda that came in late. Item under old new business. And I highlighted for you on your agenda. It's 4.6. I would like the board to approve and review the community health worker position description that we'll talk about then.
Okay, all right, thank you. So do we have a motion to approve?
So moved.
And a second? Second. Okay, all in favor, say aye.
Aye.
Okay, approval of the February 17th meeting minutes. Are there any corrections or changes to those?
There's one correction that we noted after we published to all of you on Wednesday. At the very last, the adjournment, I don't think we did, who made the motion to adjourn? That was you, BJ, so we did add it to the final notes that BJ made the motion to adjourn.
Okay, perfect. And so with that correction, is there a motion to approve?
So moved.
A second. Thank you. All in favor, say aye.
Aye.
Okay, approval of the February bill schedule. Any changes to that at all, or?
I just have a couple questions. Tell me about the new furnace, snow removal, and the grant expenses.
Is that on the first, second page?
Oh.
Under operation.
Operational.
Yep, that's the furnace we talked about in the Lennox area that went bad a couple months ago. We just, we just got the bill and completion of the work in February. That's why we got billed for it in February. That's for the last quarter. It's a small little furnace, but that was supposed to kind of come, be an addition to what the big 2 units we have.
Yeah.
And we have to change it.
Okay.
The next one is the exhaust fan in the bathrooms went bad, and that we did a service call for them to come and check it, and they did, and they found out we're gonna need a new fan. So probably the next bill scheduled, we're gonna see close to $4,000 for a new fan. We installed it a couple days ago. There's no grants money going there. This is all from our maintenance line item on the operating budget.
What about, how does the snow removal contract work?
They do charge us per visit. So every time they come and treat the sidewalks and remove snow and ice, they will charge us. That's the grant. That's the contract.
Yeah, I just thought that might be a little high since we haven't
No
had
snow.
a lot of snow.
Yeah, I think that's for a couple times that they came out. So each time they remove snow, it's about $500.
Well, we've had ice, so.
Yeah, we had couple ice storms where they came in and salted the the sidewalks, make sure they're clear for when we open.
And the other question that I had to do with grant expenses on the. Yeah.
This is that description is in the middle column. This is a lot of we use the Amazon card and the Walmart card and the to buy those incentives that Alexa's the team are buying for families, but those are brand, it's passed through, but we have to use
Okay,
the card to buy.
that's what I wanted to know.
Yeah, it's those incentives for Help Me Grow program. Yes,
So you got the money anyway.
that's correct.
Okay, any other questions? Okay, do we have a motion to approve the bill schedule? And a second?
Second.
Okay, and all in favor, say aye.
Aye.
Okay, approve and recognize the following revenue. Do you want to go through that?
Yes, we would like the Board of Health to approve and recognize the following revenue for fiscal year ending on December 31st, 2023. 2.4.1, that's a state opiate response. 2.0, that's the fund we appropriated last meeting But now we actually got the money and would like the board to recognize it in the amount of $44,407.56. Item 2.42 that I would like the board to approve and recognize this revenue in harm reduction clinic in the amount of $12,000 we received from the Adams Board for that purpose.
Do a motion to approve?
Still move.
And second? And all in favor, say aye. Okay, appropriations increase.
Yep. Now, we would like the Board of Health to approve an appropriation increase in the following items for fiscal year ending December 31st, 2023, 2.5.1. That's the money we received, and we recognized the previous item, that's for harm reduction clinic in the amount of $12,000. The sewage project, we're increasing appropriation in the other line item in the amount of $8,000. And the private water vehicle line item in the amount of $12,500. Just we're moving money around here in appropriation to make sure we have enough to pay the bills of those two line items.
Any questions, discussion? Okay, do we have a motion to approve the
So-
appropriations increase?
So moved.
And a
Second. Second.
Thank you, and all in favor, say aye.
Aye.
Okay, third and final reading.
Yes, we're doing this month the third and final reading for the proposed 2023 CPR training and certification fees. There was no change, 2.6.1 through 2.6.4. It's the same thing we reviewed for the last 3 meetings. Nothing changed there. But we would like the board to go ahead and approve a third and final reading. If you all remember, three meetings ago, we did. You guys did the first reading and approved it as an emergency, so we're already charging for those that amount. But we have to go through the motions and do 3 readings, and that would be the final one, and permanent approval of those fees. So we'd like a motion to approve the third and final reading for the proposed 2023 CPR training and certification fees.
So move.
And is there a second?
Second.
Do we have to have a roll call?
Yes, we'll have a roll call for that. BJ,
Yes.
Nancy,
Yes.
Karen,
Yes.
Robin,
Yes.
Bill, and Dr. Linda.
Yes.
All right, 6-0. Motion passed.
Okay, you want to talk about the Toyota Corolla?
Yes, we want to, the 2.7, this is authorization to enter into an agreement with Great Lakes of Toyota Findlay to lease a new Toyota. That's an extra car that we are getting for the Help Me Grow program. That car is going to be paid for by a grant that Alexa and her team applied for. And they did make provisions in that proposal to for a car lease. The cost that's going to be $372 a month, but we'd like that resolution to read this way, to not to exceed $375, because sometimes where the change will make a difference, and if it's not in your resolution, they will kick it back, and we have to wait a whole month. So we are leasing another car now for $372 a month. Not to exceed $375 for 36 months lease.
Do we have a motion to approve this lease?
So moved.
Second?
Second.
We'll do a roll call on that one too, please, BJ. BJ?
Yes.
Nancy?
Yes.
Karen?
Yes.
Robin?
Yes.
Bill?
Yes.
And Dr. Linda Moore. All right. Now, item 2.8, this is to buy an existing car that we've been leasing for the last 3 years. And if you remember back at the combination of the 2 health departments, we made a strategic decision not to buy cars, but to lease them because it will make more sense. But for that particular one, and because most of the lease terms, they were during COVID, we didn't put a lot of mileage on that car. So there's a lot of residual in the car. And I did attach to your packet here a little study that Lindsay, this is an environmental health car. So Lindsay did a little study of if we buy versus if we lease for the next 3 years. And it seems like from that study, and we're gonna be saving about $1,000 if we buy the car. And we ought to try see if buying the car, those Toyotas are usually pretty good. They don't you know, they don't take much into maintenance and stuff. So we want to try for the next 3 years, see if we're not going to put a lot of maintenance into it, and it will serve us, we'll be saving of $1,000. So at this time, we kind of moved a little money here around in the EH programs, and she did list them here. Looks like we're gonna get it out of the water fund. Is that correct? Yes, that's where they have $13,000 available. So appropriation is done, and I think the said amount that to purchase that car would be $12,000, $347.82. To that extent, I would like for the board to allow us to authorize an agreement with Great Lakes of Toyota of Findlay to purchase their red car we already leased for the last 3 years, and it's coming off lease here soon.
Motion to approve this purchase?
Yep. Second.
Hey.
Very good. BJ,
Yes.
Nancy,
Yes.
Karen,
Yes.
Robin,
Yes.
Bill,
Yes.
Dr. Lynn.
Yes.
All right, very good, thanks.
And thanks, Lindsay, for analyzing that. That always gets confusing.
Okay, staff reports.
Very good. We do have, we're gonna do a little financials here. And under new business, I wanna we wanna pitch an idea about how to go about staff reports moving forward. A little bit, I talked, we did discuss that in leadership a little bit. It looks like our board meetings are getting really long, and by the time we get to the business, it's everybody's tired and gets really hot in this room. So we're trying to kind of streamline things a little bit. And I want to see what do you guys think about doing a consensus agenda items where we have like the leadership report and all the financials all lumped into just one vote, saying, you know what, you reviewed the consensus agenda. We'll have time for questions. They'll always be here to answer your questions and discuss any items you want. But for them to just verbatim go over their written report, I think this is kind of taking a little more time. So what do you guys think of the idea of doing a consensus agenda of all the usual items, regular items like the bill schedules, the minutes, their reports? And this way we'll leave more time for more meaningful discussions on the business of the board. We ought to try it next month, see what happens. Okay, and we'll, sometimes it's hard to kind of finalize the agenda and everything in time, but we're gonna do our best to ship all the packet to you like early in the week as much as we can by Monday. This way you'll have enough time to kind of go over the material and then come to the board prepared if you have questions or you want extra discussions on a particular item. All right, do a little financials here. And you all have the usual big sheets I will provide for you. We're reporting on February now, and on the revenue trends, you'll be able to see the different revenue items coming from different programs, and the total revenue coming into the whole agency. We did bring in $319,735.27 in the month of February, and it seems if you flip on the other side of the page, you'll see comparison to other Februarys since 2016. Pretty comparable. You do. And probably, leadership is going to talk about it as they are doing their reports a little bit. We did move into the electronic medical records on February 21st. And so there might be a little delay in some of the billing and stuff like that. So it might not show on this in February or in March because in trying to set up that whole thing. But other than that, I don't see any red flags. Yeah, go ahead.
I'll just make a comment. One reason that we're a little bit lacking too is the city's portion of the assessment. It's typically been coming in January, February. There was a delay, so we just got it Tuesday, I think, this week, so that's one reason why you're seeing a little bit of a gap as well.
So it will show up on the March
Yep.
thing too, so. I think, again, no red flag, nothing, it seems like it's a regular, we're sailing through this year on a regular pace. Hope to pick it up here a little bit. A lot of our programs are seasonal, so I believe we are on track. At the end of March now, we will do a little sit down with our leadership and kind of review, where we at budget wise and if we need to do any corrective actions moving forward, but I don't foresee any issues. Dr. Kos is on spring break. He went to Cancun. Oh, we didn't know, seriously.
I think he's seeing his kids.
Yes, yes.
The whole family.
He didn't seem too excited about it. He said, but we told him to have fun and he'll be back next week. Laura's on spring break as well. So I think her report was attached. Basically, it's just a highlight of what's going on with the mobile health clinic. Basically, they're still working on the Dexcom. We're trying to organize those clinics a little better. We did enlist some of the Medical Reserve Corps to help us with those clinics as well. And we had a really good group volunteering we kind of be walking clinics for 2 days now, and all other days are going to be by appointments only. Because we felt like it's creating a lot of disruption for the regular business of the health departments. People are showing up anytime and anywhere and trying to find a window to find help with the Dexcom. A lot of staff, they were not expecting them. A lot of staff don't know the details. So we're gonna kind of make it a stand-up clinic on its own, where people will kind of funnel people coming in only in 2 days during hours, and they'll be able to get help that way. That study is going very well. It's growing. We're at about 300 individuals, and we started the 200 phase now. We're gonna go up to 500 total. Parallel study that's being done, the behavioral aspects of having a Dexcom and being diabetic and how that's affecting management of the disease. That's going a little slow, but that's about to speed up as well. I did contact the state, and we are going to do a little presentation on that project along with Dr. Grace and Dr. Kos down at the state conference in September as well. So this is really exciting. I don't know if I told you, but Dr. Grace went to Germany and presented on the project too, and he had really international, interest in that study as well. The results are amazing. I mean, just looking at the charts and how things are changing in few months, it's really promising. So I think we're excited to be part of that study, and that's going well.
I have a question on
Yeah.
Northern University. Are they touring our mobile clinic or are we touring yours?
I think she.
It's at the top.
They went down there to kind of see what they're doing down there a little bit. I think what Laura and the team is working on right now is kind of come up with a schedule for the clinics. I think ONU, they do a pretty good job on having a schedule for a whole month. So they're trying to see what's working best for them and coming up with a schedule for a whole month. This way we can advertise it on social media, on the website, and in the clinics as well. So they're trying to figure out how they went about this and kind of try to do it here. That's why she went down there to talk to their department lead down there.
I was going to say, our commend Dr. Coast. I didn't know he was in Cancun, but on his excellent article in the newspaper about
The Narcan,
Narcan and
yes, that was pretty
harm
good.
reduction. So,
That was pretty good, editorial too. Okay, we're gonna go a little bit out of, the order. You okay? Okay, because, Shannon has an event at the, pre-garden screening, is that correct? That's what we're doing? Okay, so we'll go ahead, Chad.
Okay, just two quick updates on some grants. We did get notification, I think I had mentioned to you last month, we have the Drive to Succeed grant that we applied for with the state for $15,000. We did receive that, so hopefully we're gonna be starting that April 3rd with the schools as well as the driving schools. That'll help cover, like I said, over 100 young drivers, their driving instruction. And then we just did receive, I know Gary in his reports that we had received the NASDAQ grant for expanding our student service program. We were waiting on the amount, and it's gonna be 75,000. So hopefully we're gonna have that starting up pretty soon. We have a meeting today with our community partners, with Spectrum and Equitas today, actually at noon, just doing a quick call to kind of finalize our details and our rollout on that. That's all I have, other than what's.
Any questions for Chad? Very good, thank you, Chad. All right, you're up next.
I'll just keep it short and sweet, because honestly, I don't have a lot to report on. Like Chris said, the financials, a lot of our numbers here, financial, were just like our visits themselves were within like a 2.5 week, 2 week time span, because we had to cut those numbers off. So we had a clean cut for our old system versus our new system. So otherwise, things are pretty status quo. There's a few of us going out. We went to Van Loo kindergarten screening with the mobile. Last year, what we did was we had like walk-ins after their kindergarten screenings where they could come here. The schools, and I kind of agree, are always, they don't want to associate, the school, the first day they're going for a screening with a shot. So we totally get that. They didn't want it on site. So that's what we did. Having the new system and it's just a lot more information you need up front. We weren't quite ready to just have walk-ins a couple weeks later. So we told them, they were like, well, can you bring the mobile then instead? So we're trying the mobile. Van Loo, of course, we only had about 11 kids there. The good news is almost all of them were already up to date. So we didn't have a lot that would need to see us, but LB's got, I think, like 112, 113 kiddos that are getting screened today. So we'll see and that's at the Gateway Church, and then the mobile will be outside. So we'll see. I'll report back to you if it gets taken advantage. Those are the only two schools. McCombs isn't until the mid-April. So we'll see how LB does and then maybe take it to Macomb. Otherwise, we usually have a pretty good turnout when we go to like their open house at the end of the summer before school starts. So just kind of, we don't ever like to say no without trying. So we'll try it and see where it goes. But everything else is pretty status quo. Deanna's doing great. Again, a lot of that just, we're still working out billing with the system. So I wouldn't be surprised if even next month's billing with that doesn't show. It's probably gonna all catch up in a month or so. Dan's still going through some it was kind of different on his calls for the billing happened after ours, so he's doing those now. So there's just some quirks with that system that it's all getting charted. It just will get billed later.
Do you do like a double billing check, like a manual?
So that's what I'm doing right now, especially between like
The old system.
Yes, the legacy system and the new one is we're
To check
making
back
sure
with-
that our reports, which, correct me if I'm wrong, Craig, but I think we've got HDIS through like November. So that'll give us some time to kind of check and see how things are, making sure they're going through right. Do you guys have any questions?
Shannon, can you tell the board really quick about how your staff are doing with the new system? And then Craig probably will talk about the technical aspects of it.
Yeah, I mean, it seems to be going pretty smooth. This week we were able to get our consent forms on, and we just did a Helo check-in call, so that's all set up. So they will actually, the text messages will start going out this week and calls, so those will all be automated. Those only cost us for our contract, 15 cents I believe for the first 1,000, then it goes to 10 cents. But we get reimbursed through our GBO grant, $3 per phone. So when you think of what we're paying a staff, that time is, it's a no-brainer to go with those. And then they'll also then get an email through that text where they can check in, get their demographics, they can sure of their ID and their insurance card. So if they do that, I think it's gonna make that process very smooth. The staff are adjusting to all the different clicks, you know, that you have to do in the system. And I know that's a little annoyance, but I think once they get used to it and it's going smooth, it's, you know, it's clicks or it's shuffling paper, which one do you pick? So I think that it's gonna be really, I think we're gonna end up having a lot more reports and good data to bring out of it.
Thank you. Any questions for Shannon? All right, you're next, Alexa.
Hey.
Revenue wise, we continue to go up and up, which is always great to see. Visits seem to be lagging a little bit, but we've had discussion in the past on, we aren't doing drop-offs, we aren't doing any telehealth visits. There's also been a lot of illness within the community the past month or so with home visitors and families, so we might see that a little bit lower than in past years. Still serving a total of 127 families. We wrapped up our collaboration with the OSU Extension Office last night by having our last event, and that was just such a great program that we were able to take advantage of. And the instructor, Joanne, she approached me on maybe doing another set of these courses in the summer and incorporating a little bit of the farmers market into that as well. They are aiming a lot of their programs at utilizing SNAP benefits where they'll actually double the amount. So if you spend $20 of your SNAP benefits at the market, they'll give you $20 additional dollars. And they also have like little certificates or coins that the kids will get for attending. That way they can have some money to shop with as well. So we're hoping to leverage that and maybe do another event this summer. In April, we'll look forward with collaborating with the Blanchard Valley Center to have the Easter Bunny and an Easter egg hunt. They just have a great setup with the playground. It's gated in. So we look forward to working with them on that. We're also taking the lead for a community baby shower to be completed on May 6th. We have the Finley Village Mall penciled in for our venue for that. That way, May in Ohio, we never know what the weather will be. But right now, we're really looking at agencies to come and share resources with the families. We'll be focusing on safe sleep, and we actually have Dr. Susie Grace penciled in to do a presentation. So we're really excited about that. And then just a few grant updates. Handbags That Help, we did our presentation, and now we are just awaiting that group to complete their voting process. Hancockery, once again, that's been submitted. We're still awaiting. And then the Ohio Children's Trust Fund, that was granted a full initiative. So we will be receiving $50,000 annually for the next 4 years. They did increase the term for that one from 2 years, which we're currently finishing up now, to 4 years, and that will include the cost of that lease you approved. Any questions?
Question, early in the report, you mentioned that there's 18 families on the wait list and no families from Wood County. How does that fit together?
So the wait list is divided by spots that we have for each county. So right now, our capacity in Wood County is set for 10 families because we received some expansion funding to get another home visitor. So we have to have 10 openings for that county. It's been very slow to fill because we only took on a certain amount of zip codes.
Yeah, I just was wondering
But-
whether anybody was getting shortchanged from Hancock County.
Well, we really realized that with the high needs of the families that we're serving, 130, which is our actual capacity, with the 120 from Hancock and the 10 from Wood, that's our capacity because these families that we are getting are such high needs. A lot of them don't speak English. I think Kareem has a proposition to kind of serve those families that are on the wait list and get some services in place before we're able to get them on the program. There's also some changes at the governor's level that might impact our programming later on. So before we start expanding in our county, we want to see what those plans are long-term. So for example, they're thinking about moving our program under a different umbrella. So we're watching it and we do reach out to those families on a monthly basis. We invite them to all of our groups, but we just want to make a really, really stable decision before we move forward.
But we keep them engaged as
And
much as
so
possible.
Kareem's gonna cover the topic of translation. Is that,
Yes, we've definitely moved forward with that and that's going great.
Craig will talk about it a little bit too. He's working on the logistics. Very good. Thank you, Alexa. Okay.
I'll keep it real short. I'm happy to say that we've hired a sanitarian.
Yay.
She does, her name is, Tatiana. She starts in May 15th, actually. She's right now at OU finishing up her master's in chemistry. She actually worked at Dark County Health Department in October 2019 to June of 2020. So she has a little experience. She's worked in the private water program, body art, and foods. So great conversation when we had our interview. She's excited. She actually is a Lucas County resident, so she's coming back closer to home. So we're all excited. So yay for me to come.
All right.
And the other good part is food renewals.
we'd like to see her in person.
You'll get to see her at the May board meeting. Food inspections, they were all completed with 2 days to spare, so that was great for the staff. Morale booster, we finally, had been able to get that accomplished considering the way the last 2 years went. The other thing, all of our food vendors did apply for their licensure on time, so we don't have to worry about shutting anybody down. We are getting ready to do swimming pool license bill, so if you're
Oh, yeah.
ready to jump
Observe.
into that program.
Jump in with two
No, no pictures though.
We'll let you do main drain inspection.
All right. All right. Any questions for Lindsay? Okay. Right.
Morning, everybody. Just to touch on ECW, like Shannon did for our new EMR, I think everything went as smoothly as possible. The data transfer went well. There was some things we had to work through with the old contractor, but we got all those things worked out. And there were some items later on that had to get changed, but those were fixed. So I think from a data standpoint, all our data transferred over to the new system. And as time has gone on, staff have reached out to me with less and less questions. So I think that's a good thing. So I think they're kind of realizing the benefits. Like Shannon said, it's just a little different, and getting used to those differences are the big thing. So one of the major projects we're going to start on is our health department website. Throughout the years, I think when I started in this position 7-8 years ago, so seemed like a long time, but time has flown by. But we did redo the website. We did redo the website at that time, since we had the city and the county website. So we hosted it with all the other county sites, so the county has been hosting our website. Unfortunately, Aardvark Communications, who we worked with before, have been managing the website for the county. They unfortunately went out of business. And I think the county's been struggling with the website. Every time they do an update, it seems like things on our website broke. So we haven't really been happy with our website and the functionality and the ease of updating it. So we're in the process of looking at redoing our website. The only difference is we'll hopefully have something that's a little more responsive and easy for us to update. Because right now the county controls all the back end stuff, so we really can't do anything without getting the county involved. And obviously, they're doing it for free, so they're not, don't want to do a lot to kind of revamp things. So we're looking at total redesign of the website. The only difference is we'll be paying for a hosting provider instead of the low cost of $0 that the county charges us now. Luckily, it's only between $50 and like $120 per month. So it's not less than $2,000 for web hosting. So it's not, in the grand scheme of things, not a store large cost. So that's one of the things we're working on right now. Kind of getting a designer and a hosting provider nailed down for that. So just an update on the language. We did get a grant. Crean can probably give you more specifics on the grant from the Community Foundation to do a pilot project. I know I've talked about using an application, a company called Language Services. I think the hospital uses them for their translation services. We did start some conversations and they did send us a contract over this week. Unfortunately, it's a pretty large contract and I feel like I'm almost need to be an attorney to go through it, but I have a lot of questions on the contract, but slowly going through that. But once we get that implemented, basically iPads for the staff to do, they can call a translator on the iPad. So whenever they do have clients come in and need translation services, they'll have that available to them. We're also part of the project, we're going to be providing iPads in the same program to the Family Center. So those offices out at the Family Center can also use those translation services. And so once we'll see how this pilot goes, and if we want to continue with this, good thing. But I think it will help in the grand scheme of things as more and more translation services are needed. So, you guys have any questions for me?
Thank you. Very good. Thank you, Craig. Okay, well, I'll just finish what Craig started with that translation. We did mention to the board last time our intention to apply for a small grant from the foundation to kind of fill in the need for translation services. We've been seeing a lot of different languages come into our windows. With the families that Alexa's team is serving as well. So they did approve close to $10,000 to buy a pot of minutes for $5,000. The rest, the $4,900, were to buy iPads and equipment to do with it. We would like this. Well, now they're showing up at our doors. We're seeing them. But eventually they're going to start showing up at all the public service offices. So that's why I think the way I angled my proposal to the foundation, that we'll use that as a pilot for the whole community. And to start with, we'll give a couple of those iPads to the Family Center and see what's the need there for those. And there's multiple agencies at the Family Center, and they can be used by those multiple agencies as well. So I think that's about to start soon. As soon as we sign the contract, Craig is still going over some logistics, but that's it's like a switch type of things. We just go online and we'll be able to access the service.
So our workers will have adequate number of iPads.
We should have about 5 if we put a couple in the clinics and a couple with Alexa's and one like kind of floating one on the mobile or something like that. I think we should be good. Like I said, this is all to size up the need for now. And between now and 6 months or so, we're gonna kind of sit down and reevaluate if we need more equipment or need to roll it out to community-wide. That will be that. At least we have a starting point. It's amazing, that courts are dealing with the same issue now. We got a call from municipal court in Findlay here last week or the week before, asking for translators because I believe that whoever was going in front of the judge there, they have connections to the health department somehow. They get services, but they can't speak English. So eventually, the whole community is gonna need them in all public services, to be honest with you. So this is a good start. I think we're kind of trying to lay the ground for what the needs are, and moving forward, we can do more with that. Speaking of the as far as my activities, been involved in a lot of meetings. We're gonna talk about the DAC a little bit later, then we're gonna talk about other stuff. But legislatively, there's not much going on. We're still kind of deciphering what's coming into the budget, the governor budget. That's to be approved before June 30th. There's a lot of promising thing. I did talk to you before about the $20 million he earmarked for local health department. This is really promising. If that will go through, I think we will have more resources to kind of tackle some of the initiatives on the health improvement plan as well. So we're watching, see what's going on. We're lobbying through our association down there for that as well. A couple changes in environmental health, nothing major. We're going through them. That's in the budget bill as well. The big change is going to be that new department that the governor is creating for family and children. Everybody's kind of wait and see how are we going to transition into this, what programs ODH is going to lose to that new department. And I think our biggest, it shouldn't be concerned because it should be continuation. Probably it would be better because there will be more resources available. As our Help Me Grow program, they might be moving it to that new department, but that shouldn't affect us much. But like Alexa mentioned, I think although we have a waiting list a little bit, we're putting kind of freeze on any movement in that until we figure out exactly what's going to happen by June 30th. This way we'll be on solid ground moving forward. That's how it's going to be. That's the funding. They're increasing, decreasing funding. This way we'll know exactly where we're going before we start hiring more visitors. So to that respect, I think Lindsay did not mention in her report that we are part of the mayor task force on public nuisances, and we participated in a meeting last week. That was a very good meeting. I think it's their zoning, their legal department, the city. It's about nuisances in the city, what we cannot do from a health department standpoint. So us being at the table, I think will create a lot. Will eliminate a lot of that misunderstanding of what the Board of Health can do in a nuisance complaint and what we cannot do, and what the city, how we can all team up and bring the resources in one place. I think this is going to be pretty good for all moving forward.
Question, what are the public health nuisances?
Public health nuisances, like
Yeah.
you know, we get tons of calls on anything.
Oh,
I mean, public health. You know what? Trash, garbage mostly, but we do
Housing, boarding situations.
animals, like,
Where does building demolition fit in?
Yeah.
we do not have a building inspection here in New York, Hancock County. That's one of the biggest.
So we won't make the front page.
Yes. So, and that's part of the push that when we first started, actually with Mayor Mahalik, we started that conversation about, establishing the garbage pickup and housing code and so on and so forth. But there's a lot of politics that plays into that we're not going to get into right now. But yeah, that's creating something.
Well, the reason I brought it up is at the recent DAC meeting,
Yeah.
Village mayor questioned me about that. I didn't know what the
Yeah.
policy was.
Yeah, well, and that's the difference, and that's what the difficulty with what we're trying to do is, if the city have ordinances, probably we can act on those, but those are not countywide, and kind of not treating a nuisance out in the county different than we treat it in the city, that might create an issue as well. So we want to make sure we're fair across the board, and that's how we handle it from a health department standpoint.
So exactly how does that
There-
get handled? How should it be?
Well, there's a general health code, public health code, the state code that we usually go by if we really feel like, you know what, we need to step in there. Those are very difficult complaints to deal with because people are in their houses, they don't feel like anybody should come in and tell them what to do. A lot of mental health issues goes with the hoarding part and, the trash part. So that's why I think assembling that task force, it will help. That if somebody that's, cannot keep up with their homes, maybe we can get them help, maybe through 15 or through adult services. So having all those players at the table and go, address by address where we have issues, we'll be able to size them up a little better and get better help. Instead of sending a sanitarian to, hoarding situation where there might be a mental health issue that we don't know how to deal with. Same with the city. So,
But demolition is outside our service.
are we?
One thing, if we declare a property a public health nuisance, which the board has the authority to do that, the board then has to take authority over that property and do whatever is required. So if we think that property should be torn down, Board of Health's got to have the finances to tear it down. Or if the property's abandoned and let's say there's busted out windows, doors missing, we declare it that public health nuisance, we then have to have the money to, board up the windows.
Secure it.
Secure it. So
So there's a lot involved in public health nuisances and
Can't get grant money.
subjective too.
the city actually has a lot of grant money and can do that. Also, some of
Oh,
those
really?
villages can get a hold of some grant money as well. It's probably been 15 years or so ago now, regional planning had grant money that was to help, obviously, income-based situations. And they were actually able to go out in some of the townships and take down some of the dilapidated structures. And it was done within the city as well. So I think it's just hard to get for those smaller villages, particularly to get some of those resources on their own. When regional planning can get them, I think that's when those smaller villages probably benefit a lot more.
It's not only the financial
Well,
burden.
thank you for explaining that.
It's the legal aspect of it too. I mean, if we are to go into that business of demolishing homes and stuff, we better have a good lawyer at the table all the time. Because it can get really dicey. It can get dicey. We don't have a lot of those cases, but if we get to it, we have that power to do it as a board. All right, I think that's mostly what I want to talk to you about from my end. We can move into all the new business.
Personnel, nothing?
Nothing, no hiring or separation during the month of February. Lindsay said about potential candidate coming in May. We'll bring her in here and introduce her to the board like we usually do. 4.2 annual DAC meeting happened on Monday, March 6th. It was a good meeting. We got a lot of support from the townships and the villages and who were attending at that meeting. We did present the annual report, which I gave you a copy of. And I think we're still on good terms with the DAC. That was my feeling. I don't know. We had a couple of board members at the meeting as well. I don't know how you guys felt talking to people and afterwards and before the meeting. I think there's a lot of exciting news that we roll out to them, every year, and I think that what keeps them engaged. One thing they mentioned during that meeting is how do we engage the village mayor a little better? And I think we started a plan here, and Cheryl is helping me a little bit on how kind of devise a communication plan just with the village mayors, because they're not part of that township association, and they're not, usually they're on their own. They're not aware of what's going on too much. So we want to try to engage them a little better here into the coming year.
My observation has been the DAC meeting occurs on the same night that the village council meetings occur.
Oh,
Therefore, the mayors
into that too, because, that's how it's always been. The
Oh, I
DAC has to meet in March.
I know.
And it's always been the first Monday of March, but that can be a point of discussion if they want to change the meeting to make sure that the village mayors are attending. I think it's
Yeah,
important
I
as well.
think I think that seems a pretty simple fix.
Sure, we'll look into it. Yeah, absolutely. But it was all in all a good meeting. And Robin got pre-appointed for another, for 4 years now. So for 5, right? 5 years. So, everybody was excited about that too. And usually what we do, per our bylaws, after the DAC meeting and appointments or reappointments of board members, we do a little reorganization here at the Board of Health level. This is this will mark the second year in Brian's tenure as president. And that's where we elect a vice president to kind of prep that person to be president next March after the DAC meeting. So at this point, I would like for BJ to ask for a motion to open nominations for vice president.
Is there a motion to open nominations for VP?
So moved.
And second? I would like to nominate Karen.
All right.
Second. Would the nominations be closed?
All right, Bill, motion for the nominations to be closed. You need a second and
Second. Reside rather than you.
Okay, so do we do a roll call?
we do a roll call on electing Karen as a vice president to be president next March here. BJ,
Yes.
Nancy,
Yes.
Karen, you abstain? Abstain? Robin,
Yes.
Bill,
Yes.
and Dr. Linda.
Yes.
Very good. Karen, our new vice president.
Congratulations.
Yeah, congratulations.
Yeah.
Hey.
Under old business as well, I do have a quick update on establishing a teaching public health department. I've been talking to Nancy a little bit. I think she's been tasked with putting the agreement together with the University of Findlay. She did send it to me, but I can't find it, but we'll figure out something. And hopefully we'll bring it to the board. Yeah, we'll bring it to the board hopefully next meeting, and we'll be able to discuss that. On the BGSU front, me, Dr. Kos, we did meet with BGSU. It was a virtual meeting a couple days ago. BGSU is thinking of doing some regional, and they say they'll work with the University of Findlay as well. But they're kind of gauging the need for a Center for Public Health practice here in Northwest Ohio. And I felt like this would be a great idea. And that will bring together a lot of the professions that are, that can be in public health, from nursing, from social work, from environmental, and bring them all under that umbrella of a Center for Public Health practice. Tim Miley was at the meeting. I think he arranged for that meeting. He's working now, I believe, with BGSU. And he did tell him that we have interest here in Hancock County and that he knows us, and that's why we were invited to that meeting to meet with their leadership there. Looks like a lot. It's promising. It's promising on many levels, especially collection of data. As you all know, we've been hiring the Hospital Council of Northwest Ohio to do our assessments and our data collection. We were not too happy with them the last cycle. We missed, we're missing a lot of pockets and stuff like that. So moving forward, I think as a community, and talking to Dr. Kos and Adamus and other partners that are part of this, we want to do more of a continuous collection of data, not wait for 3 years. And we want to do focus groups. We want to do a variety of things so we can capture better data. So to that extent, they're thinking that center will be able to do that. It's just a matter of, again, putting the blocks together and make it happen. So that's kind of exciting. I think it will have it will get some traction, especially with smaller counties. Like Williams County are having a hard time with staffing, and Defiance, and some of the other small counties in Northwest Ohio where they cannot do a lot of stuff on their own because of, they're small. Um, that center will be able to step in and help as well. So I think it's going to be a good resource moving forward.
Will that step on any toes of University of Finland?
We did bring that up, and we did say that they work closely with Findlay. So if, let's say, it's going to be centered for training as well. Let's say we want to talk a little bit about community health worker that that was part of the needs identified in our plan. That person who, from whatever background they're coming from, they need certification in that. So we talked about where to get certification, and that center can step in and say, okay, we'll start certification for that program. It's a 3-4 month certification that employee will go through. So training, retraining, retooling for public health, I think it will be really really valuable. Now, with the University of Findlay, at some point, we're going to have to go and talk to Dr. Fell about the agreement and about that idea. I think they will complement each other more than compete with each other on that respect. I mean, if we have a nursing program here, if we have a PA program, there's no need to get students from BGSU, but BGSU can be that coordination of all that.
Well, I was just thinking about some of their majors that they have at Findlay are very much the same as what that center would have.
Yeah, I think what BGSU is eyeing too, and they might get more help than Findlay in that respect. They are a state university and a public university in a way. They sense there's a lot of money coming into public health and mental health right now, and creating such center that will be regional, providing all those resources to smaller entities where they don't have those resources. They feel like they can leverage grants at the state and the federal level to bring into the university as well. Yeah, that's where Tim's connection there too, is to kind of how do we become regional, help the university at the same time, help our faculty, get research and get everything else, help our students get the practical they need, and help the region as well. So that's I think strategically that's what they're thinking. That's what I gathered from that meeting. But it's promising, and that's to be continued as well. Then we'll go from there. Any questions about this item? Okay. We'll move to one of the old business as well, the Champion of Public Health nominations. We did talk about it in our last meeting a little bit as a board. There was a lot of good ideas about a lot of deserving people that should be part of that. I think when we came to a conclusion during the last board meeting, that we will award this year, for 2022, the Champion of Public Health recipient, just one individual, and we will award a public health award for a partner agency. So I think those two, it's a good start. I know BJ had some ideas about lifelong awards and stuff like that. Those will need to build on probably in future. It was very short time to kind of change all the rules that we approved here and stuff like that. So I think it will be deserving to kind of nominate two and have the board vote on to nominate one agency and one individual to be a recipient of the 2022 Champion of Public Health Award. The event for awarding those, the board will vote on them today, but the event awarding the actual awards will be during Public Health Week, and it will be on a Tuesday. Do you know the date for that Tuesday? Yeah, it will be the 4th of April, and I'll send you invitations, and I will send you the schedule for this whole. So we're thinking of that would be at 11 o'clock in the morning. We'll do the presentation of awards. And then at noon, we will have a luncheon for the recipients and our staff in appreciation, and the board is very well invited to be part of that too. A luncheon from noon to 1 for, again, our staff, the recipient of that awards, and the board in appreciation of Public Health Week. But I will send you all that information once it's final in an email moving forward. So we did look at all the nominee that we got for an individual recipient of the Champion Public Health Award. And I think almost all leadership staff and I'm sure some of the board members agree as well to nominate Jeannie Plogger from Marion Township to be the recipient of the Champion Public Health Award for 2022. She's done a lot of work with the Help Me Grow, a lot of work with the mobile clinic. She's done a lot of work during COVID. She even, appropriated some money from the ARPA money they got for our nurses to be there on those clinics. She's always advocating for public health in many ways, and we felt like that will be appropriate for her to be the recipient for this for 2022 Public Health Award. So we would like a motion to open the nominations, and I think leadership and myself will nominate Jeannie Plogger to be the recipient.
Is there a motion to open nominations?
So
Second.
Second.
All in favor, say aye.
Aye.
We need to close nominations, or any other names you guys want to throw at the table?
Okay, motion to close nominations.
So moved.
Second. All in favor, say aye.
Aye.
Okay, so we'll do a roll call to nominate for Jeannie Plogger to be from Marion Township to be the Public Health Award recipient for 2022. BJ,
Yes.
Nancy,
Yes.
Karen,
yes,
Robin,
Yes.
Bill,
Yes.
and Dr. Linda Moore.
Yes.
All right. Unanimously, Jeannie Plogger is the Champion of Public Health Award for 2022. Now we need a motion to open nominations for the Public Health, Public Health Award Partner Agency. A lot of names floated as well. A lot of people helped. A lot of agency help. One kind of stand out is the Community Foundation. So the recommendations of our administrative staff is to nominate the Community Foundation to be the recipient of the Champion of Public Health Award for Community Partner.
Okay, is there a motion to open nominations?
so moved.
A second.
Second.
All in favor, say aye.
Aye.
And the nomination is for the Community Foundation.
That's correct.
Okay, so motion to close nominations.
So moved.
Second. And all in favor, say aye.
Aye.
We'll do a roll call as well. BJ, Nancy,
Yes.
Karen, Robin,
Yes.
Bill,
Yes.
and Dr. Linda Moon.
Yes.
Very good. A lot of business today. One more important business. I did include in your packet as well, job description for the community health worker. I think it's in our community health improvement plan, and one of the initiatives is to hire community health workers that can we did talk a lot in previous meetings about the need for an individual to help the families with the social aspect of what we do at the health department, what we do at the hospital, and we do at the family board. There's a big social aspect of how those individuals are faring, as far as health outcomes. The hospital have their own navigators, the Adams Board and the FRC have some navigators as well. One of the gaps we found, talking to partners, again, from the hospital and Adams and everybody else, was those navigators are not talking to each other. And that's where the gaps are. So people will show up here, they will show up at the hospital, but not knowing that that same person showing up in all three places, but they're not getting the help they need in that aspect. So we ended up from our end, and the way we saw it really highlighted was in our mobile health clinic, where we go and while we're doing outreach, our medical staff is doing a lot of the social connections and warm handoffs and so on and so forth, and they're not spending the time they need on medical, on their medical expertise. Same with Help Me Grow staff. They're doing a lot of the social aspect of case management, and they're not focusing on what they need to focus on in their scope of practice. Same with our nurses. Same with a lot of programs we have. So I think that the partnership figured, okay, we're gonna need somebody to kind of coordinate all those navigators and have them talk to each other, have a set rotation schedules. If some happen at 2 a.m. on a Saturday, how do we get people connected? How do we get into the right places? That's how the need for that position was born. I did put a lot of intent to the foundation to help, pay for 3 years for community navigator. I did talk to Dr. Kos a little bit. He said he was going to talk to Myron to see what's the possibility of the hospital helping, and same with the Adams Board again. My plan is we're gonna need that person, and we needed that person yesterday in a lot of our programs. So what we did is we talked to the state. We currently have a grant from the state to pay for a communication person. We did ask this permission from the state between now and June 30th. That's when that grant ends, to be able to reassign that money to go towards a navigator. I think this is gonna give us a head start on the whole program, and that will buy me a little more time to be able to kind of line up the money to pay for that position moving forward. Our estimation is that position is going to cost about $250,000 for 3 years. A lot of it, can be leveraged here, and we were paying rent and utilities and stuff like that. So I'm hoping that we can get help where we, from our operating budget, we budget very low, but we get the help of the foundation and some local partners. Even I'm kind of putting hope on some of the money that's going to come from when they approve the governor budget, because what we're advocating for down at the state is if that 20 million for local health department is approved, we want the governor to earmark that money going to the different departments. Of course, they will allocate that by per capita, and we'll get a little bit to go towards an initiative in the CHIP, in the health improvement plan. If that happens, probably that money we're going to get from that 20 million will cover the whole cost of that person. So there's a lot in the fire between now and the end of June, but I felt the need is immediate, and that's why I would like the board to approve the creation of that position. That's a new position to us. We never had a community health worker part of our staff. To create that position, and we'll post it for a couple of weeks like we usually do, and I'm hoping that I can reassign internal staff into that position if they are willing to, starting April 1st. This way, they will work through it April, May, and June, and we will have a few months to kind of keep talking to the foundation and see what they're very interested in the concept. They just I need to go through their board and everything else, so that's gonna take a little time. But the timing is right because their board will meet in May, and hopefully between now and their May board meeting, we'll be able to provide enough information and do a presentation where we will be funded. So in that respect, we did, since it's a new position, we did kind of mimic a similar position or exact position that's existing in Franklin County, and a lot of other positions from here and there, and we kind of pushed it all together and to make it our own and what we want, what the expectations, what the duties of that person is. So, to that respect, I think that the most important part is the first page. The other parts are kind of usual stuff that we ask for all positions, but those are the essential duties. I would like the support of the board to go ahead and approve and create that position, and with the plan moving forward, that hopefully I will have somebody in there on April 1st, and that will be paid through one of the state grants through June, on the hope that by the end of June, we'll be able to figure out funding moving for the next 3 years.
Are there any questions or discussion?
How does the community health worker with the qualification from the Iowa Department of Nursing fit in with the preferred qualifications of the applicant?
It doesn't. You caught it. Thank you for catching it.
Yeah.
So I was working on it yesterday and I had used one of our existing job descriptions, so that just may have been, and I will go back and I will change that.
Could be a nurse that's interested in that position as well, but it's not a requirement.
No.
For it to be a nurse. Even preferred qualification says a master's degree. I think we're asking for a minimum bachelor, and to make that position exempt. Moving forward, but bachelor. I think the most important thing that's attached to that is for them to get the certification within 6 months. Because ultimately, we would like to connect to a hub similar to the Pathways Hub up in Toledo, where we will be able to start billing for some of those services.
So with that correction, is there a motion to approve the community health worker position?
So moved.
Second.
Okay, all in favor?
We need the roll call. Yes. BJ,
Yes.
Nancy,
Yes.
Karen, Robin,
Yes.
Bill,
Yes.
and Dr. Linda. Yes. Very good.
Kareem, you're talking about having this person in place, what, a week from tomorrow?
Well, the first 2 weeks, I have to, by our policy, we have to post it for a couple of weeks. So I will post it probably Monday and we'll go from there. We'll go in 2 weeks.
And then you're moving someone in.
I'm moving someone already.
In the
with
help.
A little experience and from our staff into that position.
Oh, that's amazing. I thought you were doing a week.
Yeah.
That was a little energetic.
Yeah. You should have added that.
All right. There will be no CEUs today. Like I said, we're trying to streamline our meetings. We'll try a consensus agenda next time and see if that will work for you guys, or you want kind of a presentation like we usually do.
Yeah. Well, our board does a consent agenda.
Yeah.
It's a little easier to do, and this way we'll have more time for questions and we'll have more time for discussions. And this way, and all leadership are really accessible to any of you anytime. I mean, if you have a question, you don't have to wait for the board meeting. You can reach out to them directly as well. They'll be more than happy to help.
Okay, so do we have a motion to adjourn?
So moved.
Second.
All in favor, say aye.
Aye.
Okay, 8:47.
Wow, that might be our most.
That could be a record recently.
It'll be faster next week.
Yes.